Hi, this is Matt Stevens with Radiology Associates, joining you once again to answer some of your healthcare questions that you have during this coronavirus time. Perhaps you saw our last video. We discussed with Dr. Miles why our imaging centers are a safer environment for you to come into to have your exam done at this time. So today we want to extend upon that a little bit, talk about why you shouldn't delay your exam if you were thinking about rescheduling out a few months or even into next year, but why you should go ahead and have that exam done now. So Dr. Miles, in our last video, you talked about how small things can become big things if we let them go. Can you expand on that a little bit?
Well, something simple as back pain. Back pain is one thing, but if you start having pain, the next thing you lose is function. And a lot of times that function doesn't come back if you wait too long to repair it. If you're having back pain that's now resulting in weakness of a leg or a limb, that needs to be looked at.
So if I've had back pain maybe for 3 or 4 months and my doctor's recommended an MRI or an X-ray, so just to clarify, I should get in and get that done?
We can actually, as we've talked before, very safely do that for you with the distancing. We actually have extended office hours for vulnerable patients. We have separated waiting room spaces, and we can just get you in and get it done. But what you don't want to do is start losing function.
What about a screening mammogram? I've talked to a lot of the ladies in the community that are a little timid about getting out and having their just screening mammogram done. Is that a wise thing to delay right now?
It's interesting, screening mammograms are the one thing that we have learned do save lives. The way you win the breast cancer battle is detect it early. If you skip your screening mammogram appointment and you come in with a breast cancer now it's metastasized, that's a whole different ballgame.
So Dr. Miles, my last question for you would just be maybe the proximity of the technologist with the patients. In this time of social distancing, we know sometimes the technologist has to be right there with the patient to adjust them and position them. Is that an area for concern?
Not in our office, Matt. As you know, our number one goal is to keep you safe. And we have several processes in place to ensure that. One, we have extended hours. We have hours for vulnerable patients. And two, you'll see that when you come to imaging centers, everybody's wearing a mask. When we're not performing the exam, we're disinfecting for the next patient.
Excellent. Well, there you have it. Those are some general questions answered by the expert here. If you have any further questions, please feel free to visit our website. It's radiologyassociatesimaging.com. Again, that's radiologyassociatesimaging.com. And we'll see you next time for another short video.